Well, Senate Democrats now face a series of hurdles as they put together their version of health care reform. So which could be the toughest details for lawmakers to iron out? Joining me now, Republican Senator Kay Bailey Hutchison of Texas. Thank you very much, Senator, for talking to us. All right, so the House has spoken, and now it is up to you in the Senate. So how far is the Senate from passing a bill, or will Republicans just try to filibuster this legislation altogether?
Oh, Julia, we will do everything to try to slow this bill down so that the American people can see what's really in it. The tax increases, the mandates, the taking away the choice that people have. Once we have that single-payer system, it's going to take over the private insurance, and people are not going to have the choices that they have today. It's a terrible bill, and we will do everything we can to stop it.
Democrats are still trying to iron out whether the public option should include an opt-out clause for states. In other words, should employers be required to provide coverage to their workers? How will Republicans in the Senate receive that?
That's not clear at all. And even if it were clear, you could opt out and you wouldn't have these cuts. Eventually, this single-payer system is going to envelop everything. That's what happened in Great Britain, it's what happened in Canada, and it will happen here as well. We've got to stop the single-payer system.
One argument you also make is that even if a state opts out of the government health care plan, that state will still face higher premiums or tax increases. The Democrats insist that's not true.
Well, of course they will, because if you're taxing the insurance companies, which both the House and Senate bill do, it's going to raise premiums for everyone who buys insurance from that company. If you're taxing the insurance companies, which both the House and Senate bill do, it's going to raise premiums for everyone who buys insurance from that company. It's a no-brainer. Of course there will be higher costs for everyone who have health insurance now. And then, of course, it's going to be more and more expensive to have the private insurance that you choose.
Right.
So you're going to go to that government option that will clearly be less expensive and subsidized.
All right.
It's not going to work, and we're going to try to stop it. So it's taxes, it's mandates, it's cuts in Medicare, and it's going to eventually erode our system of health care today and put it into a big government-run plan.
I have a plan that is not government medicine, is not government-run medicine, not new bureaucracy. It takes a program that already exists. The plan by which members of Congress and federal employees, about 9 million of them, get their health care. And we're going to open it up to every other American. And we're going to give you...
We've got to stop the single-payer system. We've got to stop the single-payer system. We've got to stop the single-payer system. $1 trillion is what it's going to cost. So you're going to have taxes and mandates, government subsidies, more government growth. This is going to add to our debt eventually, while it is also tearing down our health insurance coverage.
All right, Republican Senator Kay Bailey Hutchison of Texas, thank you very much for talking to us.